of today's engagement, we expect you to be able to identify these inborn errors of metabolism and be able to define them. And also, we expect you to be able to explain the basic genetics and the pathophysiology of these inborn errors of metabolism. Also, we expect you to be able to briefly talk about the potential consequences if these IEMs are untreated, and also be able to describe the role of the nutrition therapy in managing these inborn errors of metabolism, discussing different types of the specialized formulas for the management of these errors of metabolism, I should say. So we'll be looking at them one by one and also understanding how most of them are caused. So really, birth defects are most one of the prevalent concerns, okay, of these inborn problems in the body chemistry, okay. Yeah. So birth defects, these are things that there is always no control over, okay. Though there could be prevention strategies, etc. That's why you see they tend to tell the pregnant women to take the folic acid to prevent those neural tube defects, and also the cessation in taking in extra caffeine, because caffeine sometimes would uh, travel from the placenta towards the fetus and etc. But really, for these inborn areas of metabolism, these are really genetic disorders that affect the process, the ability of the body to process some of the substances, leading to building up of many toxic substances, etc. And these are different, and also these are different. Uh, uh, these are different regarding the different types of enzymes, as we will see later on. And also, as you can see in the slide, we are looking at involving missing or incorrect formed enzymes, and also low secretions of these different enzymes. And also, some people have argued that there are hormonal factors that are responsible. So most children may not have visible abnormalities. These are not things that you will see clinically or physically, but the defects can be harmful and fatal. When we talk of fatal, we are talking about death. As you will see, most of them, the things are including the phenylketonuria, as we will see later on in the slides, and DTC really management involves modifying the diets and also the medications to minimize some of the symptoms, and also prevent the different complications that could come. So the clinical presentations of these inborn errors of metabolism are diverse, of a wide range, and these often include delays, organ dysfunction, and also other specific symptoms specific to the inborn error that we are looking at. So the untreated inborn errors can lead to severe complications, and also these could be fatal, leading to losses of lives. And we are going to be able to see what are the examples of these inborn errors of metabolism. Where we have the malabsorption syndrome, as the name suggests, we have the cystic fibrosis, we have the phenylketonuria, we have the maple syrup disease, we also have the galactosemia. Most of these, you will see that the names translate to the impact of what we are facing. For example, this I had explained that most of these are genetic and are caused by abnormalities in the genes or the chromosomes, and also these are inherited and acquired mutations in pre-existing genes, and also these are passed on from one generation to another, or from the parent to the offspring. So when we talk of this malabsorption syndrome, really we are looking at a disorder where most of the part where most of the absorption takes place. This is the small intestine, okay, and this can affect the macronutrients, the proteins, the carbohydrates, and the fats, and also the micro, which we know are the vitamins and minerals at the end of the day. So what are the symptoms? We are looking at diarrhea, we are looking at slow growth. Diarrhea could double as a symptom, but also could double as a contributing factor, okay, to the malabsorption itself. We look at slow growth and also the nutrition deficiencies. You realize that due to malabsorption or due to the impaired absorption, we are having the nutrition deficiencies. You remember when we were looking at anemia and we saw that some challenges due to the inadequate intake of iron could lead to this iron deficiency anemia. Bloating and gas are also some of the symptoms that could help us suspect that there could be malabsorption happening. So now the causes of this malabsorption syndrome, we are looking at intestinal infection and also inflammation and also the trauma or surgery. Remember the types of surgeries that we are looking at irritable bowel syndrome. Some of those types of surgeries could lead to malabsorption, which in the end of the day, we may have to indicate more nutrient intake compared to what we were supposed to indicate earlier. Also, we realize that this could be due to prolonged use of antibiotics. Okay, antibiotics really we are looking at these cause this damage the gut bacteria that are beneficial in the digestion and also in the absorption. This could once there is a prolonged use of this, we could start looking at malabsorption happening. And once malabsorption happens, then we talk of wasting, we talk of malnutrition happening, and etc. Also, we could talk of conditions like the celiac disease, which we'll see in detail, and also we talk of the Crohn's disease and also the chronic pancreatitis. All these impair absorption and at the end of the day impair intake. Genetic defects such as the biliary atresia, which is really we talk of a serious liver condition that affects infants, and also this occurs when the bile ducts in the liver are blocked or are absent. Okay, so this will lead to bile buildup and liver damage and all those things that could lead to the condition becoming very fatal. Okay. So really, most of these things are more to do with genetics and also the environmental factors. For bilateral, this is where we talk of the dark urine, the jaundice, and also the jaundice. Which when we talk of jaundice, we are talking of the yellowing of the eyes and the skin, etc. And we are looking at many surgeries that could be performed to enhance bile flow. So when you hear the bilateral, you talk of absent or very low bile ducts. Okay, yeah, or the bile ducts are being blocked at the end of the day. So we also have diseases of the liver could lead to malabsorption and also the pancreas. Remember, the pancreas is key for secreting some of the pancreas has the beta secreting cells. Yeah, the beta cells that secrete the insulin. It is it's the insulin of Langerhans and etc. So parasitic infections, radiation therapy, and certain drugs. You remember when we were talking about the drug nutrient interaction, that some drugs bind to specific sites that are needed to be transported, bind to specific sites where the nutrients need to be absorbed from. So we will end up having malabsorption. But also we realize that chelation could happen and also these some of these things could lead to toxicity. So what are the risk factors of malabsorption syndrome? One, we are looking at a family history of cystic fibrosis, which we will see in detail. Excessive alcohol consumption, intestinal surgery. When we talk of the excessive alcohol consumption, we realize that with too much alcohol consumption, this could damage the liver. And once it has damaged the liver, still we go back to a malabsorption happening. Also, the intestinal surgery, you remember these when we were looking at gastrointestinal disorders, and also the certain medications such as the tetracycline, the cholestyramine, and etc. All these lead to malabsorption. So, friends, now let's shift gears and look at cystic fibrosis. And cystic fibrosis is a very common inborn error in metabolism. Okay, yeah, and it is an inherited disease that is characterized by progressive damage and also digestive problems, and it decreases pancreatic function, and also sometimes it could lead to male infertility. Okay, yeah, where males are unable to give off that fertile sperm that is required to fertilize the egg. Okay, yeah, really, when we talk of this is a genetic disorder, okay, that is caused by mutation of the CFTR gene. Like you can see the abnormalities in the CFTR protein, leading to production of sticky mucus in most organisms. These include the lungs, the pancreas, and this cystic fibrosis, once it is left untreated, it could lead to damages, making it harder for people to breathe, and also leading to other challenges. Some doctor, I think it was a native doctor, he was called, if I'm to remember well, he was called Dr. Sebi. And Dr. Sebi made an astounding research and said that most of the diseases that we suffer from are because of the mucus. Okay, so there is always that accumulation of mucus is what is responsible for most of the diseases that we suffer from. However, true to it could be doubted, but then once you look at most of the etiology or the patterns in which people get diseases, there is a mucus component in it. So it could be left for research, though most of his works have been discredited. He is not a recognized doctor because he didn't go through this formal education. But he has had his remedies and he has a number of clients elsewhere that people who believe in him. But really, I'm just talking about cystic fibrosis. So whenever you hear about it, you talk of a genetic disorder which affects basically both the lungs and the digestive system, leading where there is production of thick mucus in the various organs. Okay, so once it builds up, it will start blocking the airways in the lungs, and also bringing a lot of infections over the time. So the symptoms, we are looking at pancreatic insufficiency. Okay, yeah, we are looking at pancreatic insufficiency, and also we are looking at poor growth. We are looking at chronic lung disease. We are looking at pancreatitis. We are looking at intestinal blockage, liver disease, and salty skin. Okay, yeah, and we are saying most of these can vary widely among people. Some people could present with other infections, such as a frequent lung infection, or which people could call the chronic kidney disease, chronic lung disease here, and also really most of these things people could also talk of that their stools, that people with cystic fibrosis have these false smelling tools. Well, we could talk of this cystic fibrosis having no cure, but there are advancements in treatments, really. Okay, yeah, and we find that diet therapy also plays a role. In this, we are trying as much as possible to improve the quality of life and expectancy of these individuals that are having these conditions. Okay, yeah, so we are looking at indicating those foods that will help us in aiding the digestion, and also therapies that will help us clear the mucus from the lungs, and also this support looking at regular managing or regular monitoring of these different nutrients, such as macronutrients and also other micronutrients, and also adjusting diets to improve the tissue repair. Since most of the tissues will be damaged due to the infections which usually lead to the inflammation. So it is always key that we take into consideration the requirements such as the protein intake, etc. So let's shift and also look at another IEM, which could be the celiac disease. Okay, yeah, and I hope you've heard of this. So for the celiac disease, this is an autoimmune disorder affecting the small intestine's digestive process. Okay, yeah, and really, in most cases, we talk of this. It attacks the small intestine when gluten is consumed. So when we talk of gluten, gluten is that protein found in wheat, in barley, in rye. In some instances, it has also been, I think it is found in wheat. That is what I can talk of. I'm not so sure about rice, but I'm sure about wheat. Okay, yeah. And consuming this gluten causes the immune system to attack the lining of the small intestine. Remember, whenever we talk of an autoimmune response, we are talking about the condition whereby the body failed to recognize part of it as its own. Okay, so once someone has eaten this gluten, and it is on the lining of the small intestine where the villi are found, or the intestinal villi are found. And remember, these intestinal villi have what we call the brush border enzymes, and these brush border enzymes are part of the enzymes that are responsible for absorption. So what happens at the end of the day? The antibodies will be secreted against these linings, and then it will cause the damage to these villi. And remember, the villi are responsible for the nutrient absorption, and once damaged, this will reduce the nutrient absorption. Different symptoms of celiac disease, we are looking at abdominal pain, we are looking at bloating, we are looking at diarrhea, weight loss, anemia, fatigue, and also other neurological defects. Okay, yeah. Other people have also reported of constipation,
Dis-moi,
gonadal,
Fijo.
and
Dis-le,
also
dis-le,
people
Fijo.
have reported a skin rash in some people, and also we talk of allergies that happen for people when they ingest these foods that have uh, that have gluten in them. So complication of the celiac disease, we have other autoimmune disorders. Then we have hello, Doreen,
Yes.
please mute. All right, that's good. Yeah. For the other complications of the celiac disease, we have the autoimmune disorders, the osteoporosis. I hope you remember what osteoporosis is. If we really don't remember what osteoporosis is, maybe we can tell you that this is where the bones are weakened and making them more prone to fractures. This we have just seen of recent, and also this could lead to the infertility and cancer if left uncared for. Okay, so for the therapy for this celiac disease, it requires a lifelong gluten-free diet. So in most cases, the bread we eat has gluten in it, but for these people with a celiac disease, have that special type of bread or special type of wheat products that are gluten-free, where that particular protein has been removed. So the diet therapy for this, we are still telling you that this one requires a gluten-free diet. For you, you need to be able. When someone talks about those particular symptoms like we saw of the celiac disease, the skin rashes, the anemia, the constipation, the abdominal pain, the bloating, and once you suspect that all these are a set of, or they are triggered by ingestion of other gluten, we tend to understand that this person could be suffering from celiac disease. Okay. So now let's shift and look at the maple urine disease, or the MSUD, as one of the IEM, or the inborn errors in metabolism. Right. So when we talk of this maple urine disease, really we are looking at an inherited metabolic disorder caused by BCKDC. Okay. Yeah, but really it is characterized by the body's inability to break down some particular amino acids. If that's to say, we are looking at the isoleucine, the valine, the leucine, and so this really results into the building of basically these byproducts of these, which are toxic in the blood and in the urine, leading to different cases of ill health. Okay. Yeah. So the symptoms could be the poor feeding, the vomiting, the lethargy. Lethargy means someone. When we talk of lethargic, this person is, I can't say irritable, but they are there as if they do not have any energy or general weakness. Delayed milestones, but also we have hypoglycemia as setting in. Okay, yeah, people have talked of seizures and also a distinctive odor of the urine. So really treating this, we are looking at a dietary management, low in the protein diet, and also a special amino acid supplement, and also trying as much as possible to avoid those protein-rich foods. We are not saying do away with the proteins completely, but if we could zero down to the ones that have been contraindicated in the isoleucine, valine, and leucine, then we tend to look at that. Okay, so we limit those foods that have these amino acids that cannot be metabolized properly. And also, there are some medical formulas that these people are indicated with. The same applies when we talk of the phenylketonuria. Okay, when we talk of phenylketonuria, we are looking at this being a congenital disorder, and when we talk congenital disorder, people from the medical background understand that this starts from within the womb. Okay, yeah. So this is really a rare genetic disorder that causes that is caused by the inadequacy of that particular enzyme that is supposed to be metabolizing the phenylalanine, or what you call the PAH, I should say. And this phenylketonuria is really also looking at the marble syrup urine disease. Really, we are looking at inability of the enzymes to do their role in metabolizing or in breaking down these particular nutrients. So this phenylketonuria results in the buildup of this particular phenylalanine in the body, which can be toxic to the brain and also to the nervous system if the levels are too high. Okay, so this is what we have explained. And for special medications, we are looking at low protein foods and supplements if necessary. Also, early introduction of the diet and also careful monitoring could lead to the good development in most children. In most cases, this PKU or the phenylketonuria is diagnosed in the newborns. This will help us in understanding in doing an early intervention so that we get a better results at the end of the day. Okay, and also we also look at those formulated medical foods that could help us also regulate or lower the levels of phenylalanine in blood, etc. So what are the complications? Complications of having a lot of phenylalanine, like I told you, it could lead to developmental delays, intellectual disability, behavior problems, and also etc. We are also looking at it being able to bring those toxins to your brain and also the nervous system. And once you see this, we suspect mental retardation. And also we suspect brain abnormalities, microcephaly. If you're looking at the image that I've pulled out here, this is of a mother and her two children that are having microcephaly. When we talk of microcephaly, we are looking at children that have very small heads. Also, we are looking at mood disorders being a key complication in this, and also irregular motor function. Remember, we talked of it affecting the nervous system. So, management of phenylketonuria, we are looking at that. Really, we are trying as much as possible to restrict or eliminate these high protein foods such as the meat, chicken, fish, eggs, and also those nuts, cheese, and legumes. And also, we monitor starch foods such as the potato, the bread, the corn, etc. Breastfeeding possible, but quantity must be monitored. Remember, even when we are breastfeeding, we are taking in the milk, of which the milk still has the proteins in it. And also avoid sweeteners. These artificial sweeteners, such as aspartame, really also trigger phenylalanine presence in the blood. okay, and also infants special formulas need to provide these necessary nutrients. You understand that infant formula is always fought by all nutritionists worldwide. Also, I know at the end of this process, you will know that when we talk of these infant formulas, it is if that is we are saying in those weird cases where we even don't have a mother who is willing to breastfeed that child. Okay, but in most cases, really we want a child to be exclusively breastfed for the first 6 months, and also fed and also being complemented with complementary foods for at least 2 years of age. So really, we have looked at the management of this low protein diets with fruits and vegetables and low protein breads. Remember that gluten that is in the celiac disease, it is also contraindicated here. The pasta, the cereals, and also nutrition formulas can be given. So let's shift and look at the galactosemia. Okay, when we talk of the galactosemia, really here we are looking at an inherited defect of galactose metabolism due to the lactase deficiency. And what is lactase? I hope you remember when we were talking, I think still, yeah, it was this class, when we were talking of those sugars that are found in milk, okay? The galactosemia, really, we are looking at really it not being related to the lactose intolerance, like we'll see. But here, this is caused due to the lack of the enzyme for galactose metabolism, leading to toxic levels of galactose and also phosphate. Okay, so the body's inability to properly metabolize this sugar found in milk and also other dairy products caused by maybe mutations and also other things will lead to mutations in those genes that are involved in breaking down this galactose. So once this galactose builds up in the body, still it will lead to toxicity and also other byproducts. It will be bound to, sorry, by other products leading to increased levels of toxicity. But symptoms of galactose can really vary, okay? This could include things to do with feeding problems, poor sucking reflex, the jaundice, remember, the hepatomegaly, the failure to thrive, the lethargy, the hypoglycemia, the coagulations, and also a lowered immunity. So, when we talk of the dietetic management or diet management of galactosemia, really we are looking at lactose restricted diet from birth. Okay, milk substitute formulas. These we could argue that they could be contraindicated. Yes, sorry about that. Apologies. I was saying that when we talk of these milk substitute formulas, you could argue that really they are not required. But then, for cases of this galactosemia, due to those mutations that cannot prevent that disable the genes that are responsible for breakdown of this galactose, we can't risk it. So really, we tend to go for these substitute formulas and also close dietary supervision and also monitoring with the trained dietitian's assistance. So now this is the most common one where we are talking of the lactose intolerance. Okay, and I think for this lactose intolerance, most of you people have heard about it. Really, still, it is the body's inability to digest significant amounts of lactose, which I told you that is a major sugar or the major carbohydrate in milk, and this is caused by a shortage of the lactase enzyme, and symptoms could include the abdominal cramping, the diarrhea after consuming dairy. Okay, yeah, and that is why some people do not take milk. And really, also this occurs in the small intestine. This is where the enzyme lactase is supposed to be secreted. If it is not secreted, then the lactose won't be broken down in glucose and galactose for absorption. So what happens is we start getting those nausea, the abdominal cramps, the diarrhea, etc. And it's not related to the cow's milk intolerance, but also this is a digestive system problem. Realize that some people cannot take cow's milk, but they can take goat's milk and camel milk and etc. And also, we need to be able to differentiate this lactose intolerance from the cow's milk intolerance. And management of this typically involves dietary modification, I should say. Okay, and we are saying really it occurs in 30 minutes to 2 hours after consuming lactose containing foods or these dairy products, and it varies based on the lactose intolerance or the lactose tolerance of the individual's age, the ethnicity, the digestion rate, but really the cause is primarily lactase deficiency, where the body produces less lactase after the age of 2, and also secondary lactase deficiency, injury to the small intestine or digestive diseases like the celiac disease. You remember the IBD or the inflammatory bowel disease or the irritable bowel disease syndrome, the Crohn's disease, and etc. The genetic link, some people are able to inherit this likelihood of primary lactase deficiency. Okay, so the management of this we are looking at in the young and infants, we try as much as possible to avoid those foods and formulas that contain lactose. And in the older adults, most can tolerate lactose in varying amounts. So you can only give as much dairy products to what the person can tolerate. And also, tolerance can improve by consuming small amounts of lactose at one time. Okay, yeah, you take bits by bits. Sometimes people can start taking the milk, the milk cookies slowly. Also, some people do not take the milk, but then they can take porridge with milk. So yeah, it's an area of that you as a dietitian need to explore how can the person you are dealing with tolerate this lactose. So dietary controls vary based on the individual's tolerance. This is what I have explained. And then the lactase enzyme available without prescription helps digest lactose taken with the first bite of the dairy. So management of this, still we are looking at lactose reduced milk products available in the supermarkets and everywhere, because now this was a key concern in the Western world, and also the yogurts with active cultures may aid digestion due to bacterial lactase production, and also ensuring daily diets include enough calcium and non-dairy sources like the dark green vegetables, fish with the soft and edible bones. This could also bring about tolerance. So, friends, that's what we have seen with the IEMs, but really, we can't live without looking at the food allergies. Okay, and I think these ones, and most of us have them. This is where some people have come up with the taboos, the food taboos due to the allergies. Okay, those some myths have been there here and there, but really we are looking at the food allergies, where we are looking at the abnormal immunological response to food. Okay, so this can occur when the immune system mistakenly identifies some foods as harmful. Okay, don't confuse this with the the autoimmune response. The autoimmune response here, the immune system is fighting the body. But when you talk of food allergies, you could even get a food allergy of a food that you've been taking for the past 20 years. This can happen abruptly, where the body starts secreting its defensive mechanisms against the food that you're trying to eat. That's why we are talking of the body failing to identify that as a particular food. And this can be severe and life-threatening, triggered by allergen amounts. Allergen, these are factors that are responsible for allergies. So, non-allergic food intolerance, here we are looking at the reaction not immune related. Okay, yeah, and this can result from pharmacological effect, enzyme deficiencies, irritants, and also effects usually are chronic, and these diffuse and these are really life-threatening, the non-allergic food intolerances. And these require relatively light food amounts for adverse effects to happen. But if at all someone has eaten a few foods, then it's okay. So the types of the food allergies, we have the immunoglobulin E mediated food allergies, and also we have the non-immunoglobulin E mediated, the non-immunoglobulin E mediated allergies. Okay, so when we talk about the immunoglobulin E, really what we are trying to talk about is also what we call the immune system's reaction. Okay, this is where the immune system's reaction production of the antibodies of the immunoglobulin kind in response to certain allergens. So when a person with the immunoglobulin E allergies comes into contact with an allergen such as maybe pollen or certain foods or insect venom, so this immunoglobulin E will trigger those antibodies that are responsible for fighting that particular disease, that particular food, or that particular allergen. Okay, yeah. So those that are mediated, the ones that are mediated by immunoglobulin E, that's where we see the wheezing, the angioedema, the rashes, the vomiting, the anaphylaxis, etc. But for the non-immunoglobulin E mediated, we are looking at diarrhea, pain, allergic rhinitis, atopic eczema, enteropathy, and constipation. Really, these for those that are non-immunoglobulin mediated, really the the signs or the adverse effects are not really more life threatening compared to the ones that are IgE mediated. Okay, so also we have some respiratory symptoms of allergic reaction. You could talk about the sneezing, the coughing, the shortness of breath, and etc. When we talk of the anaphylaxis, you are looking at swallowing difficulty. Okay, the and etc. All these some could be life threatening, really. Common allergens, we have the peanuts, the tree nuts, the milk, the soy, the fish. Someone has argued that all foods can cause allergies depending on the individual's tolerance towards them. And in children, you have the cow's milk, the egg, the soy, the peanut, the tree nuts, the fish, the crustaceans. All these are sea creatures, and also in the adults really it's mostly the peanuts and the tree nuts, the fish and the eggs and etc. And some people have said they grow with their allergies. For what he had allergies to when they were young, then even when they grow up they will still have these allergies. Also for the immunoglobulin E mediated, they're looking at a medical history. When we are trying to manage, we tend to look at the medical history of these. We take skin tests, the blood tests, the ELISA, the dietary restriction, the oral challenge test. For the non-immunoglobulin E mediated, we're looking at, well, this is more challenging and it relies on dietary restriction or oral challenge tests. So a special team needs to be involved, and we'll look at a complete avoidance of some allergens. Okay, yeah, all those factors that trigger release of this immunoglobulin E that will in turn release the antibodies to fight the food that is brought in the body, and those reactions will bring to the allergic reaction that we see physically. Also, the dietitian's role is to ensure allergen avoidance really, and also minimize the nutrition imbalances, provide those alternative sources of the nutrients to those that cause the allergies, and also offer basically the counseling, the guidance, and also the education to these people. Also, we try as much as possible to ensure a complete allergen avoidance as we saw, and also minimize nutrition imbalances, providing alternatives or substitutes, education, checking ingredient labels. Remember, nowadays it is more to do with economic access to food. People have been talking of availability of food going through the farms and etc., but really with most of our population going to urban centers and suburban areas, we are looking more at economic access to food. Okay, so we are trying as much as possible to sensitize our people to check for these ingredient labels, recognizing alternative names for allergens, so that you are well versed if an allergen is spelled differently or if it is mentioned differently. You help and give better choices to the individual who is purchasing this, and also exercising caution when eating out in those restaurants or those cafes or even at the parties, and being mindful of those cross contamination risks that could happen that a food might not be having those foods. For example, you people who tend to go for those picnics, all the weddings these days are found in you call them gardens, yeah. So the pollen that could fall on your food and it could trigger an allergic reaction that could be life threatening to an individual. So, friends, that's what I had for you for today. We have been looking at a number of things to do with the inborn we have been looking at things to do with the inborn errors of metabolism, looking at the genetic predisposition, looking at malabsorption syndrome, cystic fibrosis, really, where we are talking of accumulation of the mucus and etc. And also the celiac disease, where we are looking at disfiguring the linings of the small intestine due to the ingestion of the gluten. But really, a lot of things we have seen there, the phenylketonuria when phenylalanine is too much in the body or in the blood, leading to different defects such as microcephaly, such as mental retardation and etc. Galactosemia, where we do not have that gene that is responsible for breaking down galactose. The lactose intolerance, this we are looking at lactase enzyme being absent. But then the food allergies, we are looking at the secretion of that factor that will fail to that will act to antagonize the different foods that we are taking into the body. So, friends, that's what I had for you for today's engagement. Let's meet tomorrow, same time, unless there is a question. I actually beg to stop here for today's engagement. Thank you for attending.